Is calcium dangerous to take every day? Yes. Taking too much calcium easily from calcium products can cause hypercalcemia, many calcium in the blood. Conditions like chronic kidney disease can reduce the kidney's ability to excrete calcium. And medications for treatment of hyperthyroidism or cancers may increase calcium level in the blood. Conditions like these can stimulate bones to release more calcium into the bloodstream. Drugs such as thiazide diuretics can increase blood calcium levels too. Vitamin D toxicity. High levels of vitamin D can increase absorption levels for calcium intake from the GI tract. Overuse of calcium supplements. Easy to get, excessive intake of calcium or vitamin D supplement can lead to hypercalcemia. Taking more than recommended is the direct cause of hypercalcemia. What are the symptoms? Hypercalcemia can have various effects on our bodies, ranging from mild to severe symptoms. Effects on the heart and blood vessels. Calcium is an essential mineral to control blood pressure, but increased condition may raise pressure due to its effect on constriction of the blood vessels. And also, calcium has an electrical activity and play a crucial role in the heartbeat. But hypercalcemia can cause irregular heartbeats and on an ECG. It can cause a shortening of the QT interval, reflecting changes in the cardioelectrical system. Renal dysfunction, a little bit more serious than GI troubles. Kidney stones formed by high levels of calcium and oxalate cause harmful conditions for overall health. Interfering functions of the kidney may cause frequent urination due to uncontrollable urinary system. The worst is kidney failure. Severe hypercalcemia can cause nephrocalcinosis. This directly damages kidney organs and is a great risk factor of kidney failure. GI troubles. Gastrointestinal symptoms such as nausea and vomiting, abdominal pain, and constipation are usual. Excess calcium intake can ruin a normal functioning of gut and motility. Perhaps it is a simple sign to quit calcium in daily lifestyle. Effect on skeletal and muscular system. High levels of calcium for a long time can weaken bones and result in reduced density. Generally, elevated calcium weakens the muscle and its neurological system. You may feel impaired muscle function and fatigue too. Tips for preventing hypercalcemia. To avoid these symptoms, need to focus on recommended calcium dosages. Stick to the RDA, which varies by age and sex. For the average adult, 1000 mg per day is recommended, and women may take up to 1200 mg if age is over 50. Balanced diet will be the best. Get calcium from a combination of dietary sources. A well-calcium balanced diet and regular checkup are necessary if you are already at risk of hypercalcemia. Monitoring vitamin D intake may help to control the levels. Increasing fluids simply by drinking enough water can dilute calcium in the blood and have to excrete excessive amount throughout the kidneys. Medications like bisphosphonates, calcitonin, and corticosteroid can be used, but you need a prescription first. In severe cases, hemodialysis may help. Oxalate-containing food. For the preventing renal stones, oxalate intake should be controlled. There are some examples avoiding or limiting for clean kidney. High oxalate food. Much high oxalate in some foods are risky for hypercalcemic conditions. Spinach is the most famous in these categories, and beet greens and many other green vegetables are high in calcium levels. Beets, okra, and sweet potatoes need to be avoided. Nuts like almonds and cashews are also containing high levels of oxalate. Among fruits, berries such as raspberries and blackberries have a lot more than other berries. Soy products and brown rice should be considered too. Low oxalate food. Then what are oxalate limited food? Kale and collard greens are valuable in leafy green family. They have lower oxalate compared to spinach and other vegetables. Cabbages, cauliflower, and zucchini due containing fewer or lower oxalate. In fruit, bananas and melons are good choices, and dairy products and eggs will help. Simply by focusing on these lower oxalate alternatives and adjusting your diet accordingly, you can effectively manage your oxalate intake and reduce the risk of kidney stones and other related health issues.